Good morning. The Senate Appropriations Subcommittee on Labor, Health, and Human Services, Education, and Related Agencies will please come to order. Today we are having a hearing on the Biden administration's fiscal year 2023 budget request for the Department of Health and Human Services. Senator Blunt and I will each have an opening statement, and then I will introduce our witness, Secretary Becerra. After his testimony, senators will each have 5 minutes for a round of questions. And while we were unable to have the hearing fully open to the public or media for in-person attendance, live video is available on our committee website. If you are in need of accommodations, including closed captioning, you can reach out to the committee or the Office of Congressional Accessibility Services. Secretary Becerra, I'm glad to have you before our committee today to provide answers to the questions the American people have, especially this morning, given the alarming reporting that the Supreme Court is planning to end the constitutional right to abortion in this country and overturn Roe v. Wade. If this is true, it will be devastating to many people across the country. I have been warning about this for years, and I want you to know I'm going to keep fighting back with all I have to protect every woman's rights in this country. But people across the country are worried. They need to see leadership from the Biden administration on this, so I hope to hear more from you today about what the administration's plan is to respond to this and protect women's health, because make no mistake, women's lives are on the line. Later this week, you will be hearing from my constituents firsthand coming out to Washington State. We will welcome you there. And Mr. Secretary, I want you to know people are not just worried about this attack on abortion. They're worried about other challenges they're facing as well. Because the past 2 years, to say nothing of the past 2 days, have put such a strain on families and communities in our entire healthcare system. People are depending on the Biden administration for support, for resources, and for real solutions, and I'm pushing to make sure that they get them. After all the hard-won progress we have made in the fight against COVID-19, families in my state and across the country are depending on us to pass urgently needed emergency COVID funding for tests, for treatments, and vaccines to protect our communities across the country. But keeping up the fight against COVID is just the start. We have to learn from this pandemic and strengthen our public health system to make sure we're better prepared with more resources for CDC like this budget proposes, with sustained annual investments for local health departments like my Public Health Infrastructure Saves Lives Act would provide, and with steps like my Bipartisan Prevent Pandemics Act. Because we know all too well things like modern data systems, a robust public health workforce, access to tests and vaccines, clear information, and more can make all the difference when it comes to saving lives during a public health crisis. But Secretary Becerra, the past 2 years have also shown a harsh spotlight on the other healthcare challenges our communities are facing, like the mental health crisis, which the pandemic has made even more devastating, especially for our kids. Over the last 2 years, we have seen a sharp rise in youth mental health emergencies. I've heard from so many parents back home whose kids are just not okay. And over 200,000 kids have had their world shattered by the heartbreaking loss of a parent or a caregiver. And we are already stretched thin when it comes to providing communities the support they need to address these crises. In Washington State, our mental health workforce is only able to meet 17% of our state's needs. We've just got to do better. This budget has crucial support for school-based mental health care and training, which can help reach students in need, mental health support during early childhood, which is such an important time for kids, community health centers, which help families across the country get connected to mental health services, and increased resources for the 988 Suicide Prevention and Crisis Lifeline. I'll be digging in here during questioning and during your visit to Washington State later this week, because I want to know how the administration is doing and what it is doing to address the mental health crisis. Secretary Becerra, I also want to hear more from you about how the administration is working to address our nation's substance use disorder crisis, which has gotten so much worse during this pandemic and has grown even more deadly due to fentanyl. I hear about the tragic consequences of this crisis every single day. Overdose deaths in Washington State have increased by 2/3 since 2019. And nationally, we recently passed the tragic milestone of over 100,000 overdose deaths in 1 year. Our communities are doing what they can, but Mr. Secretary, we desperately need reinforcements. The significant increase in this budget for prevention, treatment, and recovery efforts is absolutely necessary. But it's going to take more to get this done, and that's why I'm working with my Senate colleagues on bipartisan legislation. But I want to hear more from you about your plan to address this crisis. When it comes to women's health, I was relieved to see this budget does include significant resources for the Title X Family Planning Program, which helps get women birth control they need to plan a family on their own terms, life-saving breast and pelvic exams that detect cancer early, and more. Mr. Secretary, I have fought hard to protect the Title X program, and I heard from Washington State patients and providers recently about what this program means in their lives. They told me firsthand how it makes all the difference to people with the tightest budgets who might not have access to this basic, life-saving health care without Title X. It's unthinkable to me anyone would not support this program, but as we are being reminded every day, Mr. Secretary, reproductive health care is under attack at every angle, and we need to be doing everything we can to protect it. So I want to hear more from you today about what we can do to continue strengthening this program and do everything we can to support other programs that protect women's health. That's why I was so pleased to see this budget also increases resources to help lower our nation's unacceptably high maternal mortality rate. And like so many other issues, we know our maternal death rate has been particularly devastating for Black and Native American women, which is why the investments in this budget to advance equity and reduce health disparities are vital, especially the significant proposed increase to CDC's work in this space. This budget also calls for additional support in the fight against HIV/AIDS to increase access to life-saving treatment, reduce new cases, and continue our progress towards ending this epidemic in our country. Finally, I want to make crystal clear how important it is that we invest in child care and early education programs and bring down those costs for parents. This pandemic has made clear to everyone what I have been saying for years. Quality, affordable child care is not optional. It is essential for parents, for kids, for our businesses, for our economy, for everyone. When it comes down to it, parents not being able to work because they cannot find child care is never just a problem for them. It's one more position a small business can't fill, and it's one less link in our supply chain moving things along. That is why I believe this has to be a top priority to help parents get back to work and to lower costs that are such a massive strain on parents' budgets right now. Mr. Secretary, I know this budget includes a boost in child care resources. I was glad to see that, but I need to be clear right now, millions of families across the country are struggling to find or afford child care. Providers are struggling to keep their doors open, and child care workers cannot make ends meet and are leaving their jobs to find better pay. So we've got to go bigger to solve this problem here, and which is why I've been fighting so hard to make a truly historic investment in child care that would bring down costs for families, bring up wages for workers, and all fully paid for simply by asking those at the top to pay their fair share. I'm going to keep pushing to make sure we get that done through reconciliation, because at the end of the day, as happy as I am to see these boosts for child care in this budget, which I fought for a long time as well, it's clear to me we can't just tinker at the edges here. We need bold solutions, and that's why I will keep pushing to deliver on that, just as I am pushing to keep for more progress in all the issues that we'll be talking about today. I always like to say that a budget is a statement of values, and I'm pleased to see this budget does make it crystal clear that the administration's values are in the right place. But families back home need us to do more than just state our values. They need us to live up to them. They need us to act on them with steps that take stress off their shoulders and money back in their pockets and actually solve the problems they are facing. So I look forward to working with you and President Biden to make sure that happens. Thank you again for being here. With that, I will turn it over to Senator Blunt.
Thank you, Chair Murray. Secretary Becerra, I certainly appreciate you being here today. We served together in the House, but I think in the last year we've had a chance for our relationship to grow, and I'm grateful that that's happened. I'm grateful that I think you've made a better effort than we've seen sometimes in the past to get information to us as quickly as you could. And as you and I have talked about, sometimes we just need to know the direction you're headed in a quick way and find out all of the granular detail when you can get to it. But I'm appreciative that I think that's headed on a better path. I think both Chair Murray and I are eager to try to get a bill completed this year. You're much better off if you have money to spend in next year's spending cycle, October 1, or even December 1, than if it's April 1 or March 1 or May 1. And I hope we can work together to continue to move this progress forward. I do think that the completion of the process last year was late enough that some of the gains we made in the final appropriations bill aren't reflected in the budget that was submitted and by the president, and I look forward to a chance to talk to you more about that. You know, last year's hearing, my opening statement focused almost totally on the pandemic. At that point, we were a year in. The Trump administration had provided the country with several FDA-authorized vaccines, tests, and treatments for COVID-19, while starting a campaign to vaccinate the most high-risk Americans. And of course, the Biden administration continued that vaccine campaign. Where we were last year was pretty significant in terms of the vaccines that were available and what we'd done, considering the fact that a year earlier, we'd never heard of COVID-19, and we were making real progress. The Biden administration came into the White House with lots of COVID promises on how it would get it under control and do so by following the science. Unfortunately, I have some concerns that the administration has really abandoned the approach of following the science when it became clear over the last year and a half that federal vaccine mandates, school closure guidance, mask requirements on public transportation have, I think, overreached the moment and overreached the science. Most recently, politics appear to have colored some of the COVID decisions the department or others that the department's responsible for have made. The CDC announced the termination of the Title 42 order last month. They announced it would occur at a specific date in the future, but they announced it at a time when we were still trying to deal in the Congress and with your department of the ongoing challenges of COVID. You know, COVID can't be a challenge one place and not a problem, in my view, at another place. Congress has been provided few details on the impact of the decision of what would happen if Title 42 goes away at the border. No plans to see what we do with an influx of illegal individuals into the country, or in your department, what happens with the unaccompanied children that would become under your responsibility. I don't see the money in this budget reflecting every news story I see about how those numbers intend to grow. Further, CDC's decision to vastly increase the number of people coming into the country who were unvaccinated, made after CDC said what they considered the current, this is their quote, current public health conditions and an increased availability of tools to fight COVID-19 allowed the border to be looked at in a different way. Just days later, the department made contradictory decisions to extend our own country's public health emergency. Emergency here, not a problem there, really doesn't make much sense to many people, and even people in the Congress who can be persuaded that things that don't make sense somehow do make sense. Just yesterday, the CDC updated guidance that 2.5 years into the pandemic, it's now recommending everyone get tested before domestic travel. It seems to me that's so out of focus with every other discussion that's going on, and hopefully we'll have a chance to talk about that today also. I think these decisions just aren't consistent and intellectually create lots of problems. How do you expect Americans to follow your recommendations when you say it's safe to open the borders to unvaccinated immigrants, but not safe enough to remove masks on planes, and not safe enough to have even domestic travel without a test? Meanwhile, even as the borders reopen as if the pandemic's over, Americans remain under federal vaccine and mask mandates, and the department's asking Congress to provide additional funding for therapeutics, for tests, for vaccines. And I want to make it very clear, I'm actually for that funding. You and I have talked about it. I've worked hard to try to come up with a package that would provide the money we need. Those accounts, in my view, need to be restored. We're not out of the woods yet with COVID-19, and we need to be prepared for a future wave that very easily could happen. We need to think about what needs to happen with vaccinating the under 5 population, under the 5-year-old population, and to ensure that any American who needs a therapeutic can get one. Unfortunately, the administration made 2 poor decisions that make this additional funding nearly impossible. First, it pushed through a $1.9 trillion COVID-19 funding bill that provided less than 6% to COVID and less than 1% of funding toward vaccines and therapeutics, and only 5% toward COVID public health. Simply put, the administration had the opportunity to purchase more vaccines, more tests, more treatments, and to continue more research into additional therapeutics, and to prepare for a disease that will likely be facing for the next several years. And in that huge package that went into the economy, not very much of it was dedicated to the purpose of the COVID-19 fight that was said we were in. Secondly, we were actively negotiating a bill last month to provide the department with $10 billion to purchase those additional therapeutics, vaccines, and tests. And right at the end of that negotiation, before the Congress could vote on the bill, again, CDC announced that COVID's not a problem at the border. Finally, Mr. Secretary, as it did in last year's bill, COVID-19, I think, has been overshadowed by the budget request. I think assuming that we'll just continue to do all of the COVID spending as emergency spending. There are a lot of new plans in this budget that the Congress just rejected in the omnibus bill. And frankly, if we have a bill this year, and I hope we do, I think we have to look at what this Congress was willing to agree to after months of negotiation and use that as the blueprint. Doesn't mean the blueprint can't be adjusted, but assuming we're going to see dramatic changes, like the removal of the longstanding Hyde Amendment. Every person on this committee who's ever voted for a final labor HHS bill has voted for Hyde since it first appeared in 1976. And the bills you and I voted for in the House, if we voted for the labor HHS bill, all had that amendment in them. Ms. Secretary, the committee's been successful over the last several years of passing bipartisan bills because we've made fundamental, drastic funding something to talk about, but we first of all have taken care of the major work of the committee. I was concerned when I saw the money for ARPA-H, which I also support, but there's $4 billion of new money in the budget for ARPA-H and no money for the traditional research at NIH, which of course is exactly what people who've been concerned about ARPA-H have been concerned about, whether it was at NIH or somewhere else. Does ARPA-H begin to slow down the momentum of the overall research that we need to continue to see in NIH. I hope we can set aside our partisan difficulties as we did last year in this committee and support programs like maternal mortality programs that benefit all Americans, the mental health programs. I will say that I was very heartened with the mental health program increases and had some concerns about some structural changes in the mental health agency of SAMHSA that you're responsible for, but we'll get back to that and talk about that later. And again, while this will be a challenging hearing, as these always are, welcome, and I appreciate our chance to begin to work together with this new responsibility that you've taken in the last year, and look forward to time to ask questions today.
Thank you, Senator Blunt. Again, welcome, Secretary Becerra. Our witness today is Xavier Becerra, the Secretary of Department of Health and Human Services. Again, thank you for joining us. It's important that you are here. We look forward to your testimony, and with that, you may begin.
Chairwoman Murray, Ranking Member Blunt, and members of the committee, I look forward to discussing with you the President's FY 2023 budget. But it is most important that I begin today by responding to the chilling news that certain justices on the Supreme Court appear to be plotting to dismantle settled legal authority that recognizes and protects every woman's right to make her own decisions about her health and her body, including abortion. 22 years into the 21st century, and nearly 50 years after Roe v. Wade, some, mostly men, seek to impose their judgment over every woman in America who may seek to exercise her constitutional right to privacy and personal decision-making. That is dangerous, that is wrong, and that we must repel with every just bone in our body. America is not a nation prone to regression, and the Department of Health and Human Services is not in the business of stripping Americans of access and protections to care. So at HHS, we will double down on our authorities to protect every American's right and access to reproductive health care, including abortion. Turning to the budget, first a recap. Today, more than 250 million Americans have received at least one dose of a COVID-19 vaccine, and 2/3 of adults over age 65 have gotten a booster shot. We've also closed the glaring gap in vaccine rates across communities often left behind. It has paid dividends to surge resources, including tests and treatment, to our hardest hit and highest risk communities. 340 million free COVID-19 at-home tests shipped across America, 270 million free N95 masks, 100 million booster shots, almost $186 billion in provider relief funds distributed through more than 800,000 payments to over 441,000 providers for COVID losses and expenses. That's 441,000 hospitals, community health centers, doctors, pharmacies, nursing homes, rural health clinics, behavioral health providers, and many more. Real money, real relief, real results. That's why it's critical that we have the funds to finish the fight on COVID-19. It's not just a good investment for our health and all of our people's health. It's a smart investment for the health of our economy. Beyond COVID-19, today more Americans have insurance for their health care than ever before in our country. That includes a record-breaking 14.5 million Americans who secured health insurance through the Affordable Care Act. Many of those insured Americans are paying less than $10 per month in premiums for that solid insurance coverage and the peace of mind that comes with it. I'm also pleased that last week the FDA issued 2 proposed tobacco product standards, one prohibiting menthol as a flavor in cigarettes and another prohibiting all flavors in cigars. These standards are based on scientific evidence and would improve the health of all Americans. In addition, we launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 of our Afghan brothers and sisters resettle as refugees in America. And we have begun to extend support to Ukrainian refugees fleeing the Russian invasion of their homeland. As you know, we're working to tackle America's mental health challenges. We're coordinating nearly $300 million with our 50 states, tribal governments, and territories to prepare for the launch of the new 3-digit 988 National Suicide Prevention Lifeline this July. What 911 is for local emergencies, we're working hard to make 988 for Americans experiencing a mental or behavioral health crisis. On sexual and reproductive health care, including access to abortion care, which is still legal and available, the Department has worked to restore the Title X Family Planning Program, awarding $256.6 million in grant funding to restore access to care nationwide and strengthen program rules. This importantly fills service gaps caused by more than a quarter of Title X providers withdrawing from the program under the previous administration's rule. We have also made funds available to help with clinics in dire need, issued guidance under EMTALA to help patients access emergency services safely, and guidance to support providers against discrimination. We are continuing to do our work to ensure access to quality care for all patients. We've made these investments to close holes in our public health system in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby from 2 months to 12 months. We recently awarded $16 million to community health organizations to expand HHS's maternal and child home visiting program. And we're working across agencies to make more children eligible for high-quality early education programs like Head Start. The President's 2023 budget lets us build on that record of unprecedented investment in America's health. It proposes $127 billion in discretionary budget authority and $1.7 trillion in mandatory funding, including a standout and historic investment to transform the mental health infrastructure in our country, a priority I know you share. We also asked for $82 billion for the President's pandemic preparedness response to get ready for whatever might come next after COVID-19. Considering that COVID has cost our country more than $4.5 trillion in direct support from the federal government so far, this is a no-brainer to continue fighting COVID-19 and prepare for any future pandemic. Madam Chair, members, we are here to turn hardship into hope, inclusion into opportunity. We look forward to working with you, and I look forward to answering any questions you may have.
Thank you very much, Mr. Secretary. We'll now begin a round of 5-minute questions of our witness. I ask my colleagues to please keep track of the clock and stay within your 5 minutes. Secretary Becerra, when Texas passed its highly restrictive abortion ban, President Biden promised a whole-of-government response, and in a statement yesterday, he said the administration will be ready when any ruling is issued. What can you tell us about the administration's plan for a whole-of-government response to defend the right to abortion?
Madam Chair, as I mentioned before, we are working at HHS through a reproductive health care task force that we established to make sure that we continue to protect the rights of women that exist today, those rights that exist today, to have access to care. We've expanded program services like Title X, and we will work with all of our partners throughout the federal government to make sure that every woman has the legal right to access the care that she's entitled to.
Well, I've been really alarmed that some Republicans have made it clear they don't intend to stop at abortion. Some saying the case that ruled against birth control bans was wrongly decided, and they've refused to increase funding for Title X program, which I've been talking about. That provides funding for birth control, cancer screening, life-saving care. And in fact, they voted to undermine that program just last week. Now, HHS approved but had to turn away dozens of highly qualified applicants for this program in March as a result of flat funding. Can you tell us what that means for patients?
First, I want to make note that because Congress was successful in passing its omnibus budget, we're going to be able to do far more than what the President's budget first proposed, because it was based on a baseline using the continuing resolution funding levels. So we will do much more working with you to make sure adequate funds are available for programs that provide women access to the care that she needs. We're also going to make sure that we speak to all those providers who are out there who have an obligation to make sure women are receiving the services they're entitled to. I yesterday spoke to a number of health plans, representatives of various health plans throughout the country, to make it clear that we intend to enforce the law when it comes to women accessing the care that they're entitled to.
Can you tell us how the proposed increase in HHS will expand access for women of color and low-income women?
We're working hard to make sure that we're addressing some of the maternal mortality and morbidity circumstances that we see in this country, where typically a woman in the Black community, in our Native populations, will suffer the consequences of lost birth, possibly loss of life, in far greater numbers, probably 3 to 1 compared to in the white community. And so we are investing in the President's budget close to $500 million to increase our services in maternal health and mortality. We are also calling on states through the American Rescue Plan to increase the number of days that a woman is entitled to postpartum care from 60 days under Medicaid, to 365 days under Medicaid.
Okay, thank you. On another topic, I am really concerned that further delay in passing emergency COVID funding could undermine our hard-won progress. What are the immediate effects if Congress does not provide more funding for the COVID-19 response as soon as possible?
Madam Chair, thank you for that question. I've said this publicly many times. We have been first in line to receive vaccines, some of the therapeutics, the antiviral medications, because we have been at the beginning of the negotiations to have access to those therapies and drugs. Without the money to make the long-term commitment going forward, we can't assume that we will get first in line. Many other countries are already negotiating for access to those treatments. And what we need to do is plan ahead. We have a stock right now of vaccines and treatments that cover us for the next several months. But we can't say that if there's a new variant that hits, or if we need to buy the next generation vaccine, that we'll be the first in line if we don't have the money.
Meaning
now.
there's a limited supply and we won't have access to that supply unless we have the funds available now?
Correct.
Okay. Parents across the country are waiting anxiously for vaccines for young kids. I know FDA is working on this, but having safe, effective vaccines is the first step, and we need the administration to be ready to distribute enough doses and make it easy for parents to get them for their kids. Are you ready for that?
We're ready and anxious as you are. As you said, safe and effective are the key words. FDA will move when they have the data that reflects that they are safe and effective to use for those under 5 years of age. And we're already coordinating with a number of providers, including pediatricians, to make sure we're making those available as quickly as possible.
Do we have enough doses available once it's approved?
We will be able to purchase because we made a reservation of funds to make sure we could purchase. But once again, how much, how far, and what the vaccine might look like will determine whether or not we have access to the supply we need.
Thank you very much. Senator Blunt.
Thank you, Chair. Let's talk about ARPA-H for a little bit. This, for people who've not been thinking about it, it's an idea the President has to take the long experience with DARPA, Defense Advanced Research, which is different than the way we've done basic health research. And in those instances where we can work toward a rapid conclusion and a more hands-together partnered way to do that, I'm for that. Chair Murray has supported the approach of trying to get there quickly. She and Senator Burr have introduced legislation to codify this concept. I really want to ask two questions here. And one is, talk a little bit about your decision to structurally put ARPA-H under the NIH umbrella, but directly reporting to you, and then we'll come to the spending decision later.
Senator, thank you for the question and the support you've provided to ARPA-H. ARPA-H, at the end of the day, is like NIH, an agency that takes that research. But how it differs from NIH is it wants to be able to launch from the pad very quickly, and working in partnership with the private sector, those innovators that are out there, the biomedical scientists, be able to actually give the American people a product quickly. And that's why we want ARPA-H to be more nimble, more facile, and have the opportunity to break away from the tethers of governance that you see in NIH to be able to launch as quickly as possible. We believe we're going to be able to do that while using the efficiencies that NIH has. So, for example, starting up your human relations office, your payroll office, your accounting office, rather than have ARPA-H have to start from very scratch, make use of what NIH provides, but give them the autonomy to launch the way they think fit.
And at ARPA-H, I think, as I've heard that discussed, while all of those assets would be there, the umbrella agency of NIH. The ARPA-H system would not necessarily work like the NIH system. You'd have ability to bring people in for shorter periods of time, understanding that this is a project, we're bringing you in to work on it, and at the end of, say, 3 years, we expect this project to be done, and you'll have the ability to go on to some other work somewhere else. Is that sort of your understanding of this as well, Secretary?
That's correct. It will not work the way NIH works. It will work much closer to what you understand to be the way DARPA works in the Department of Defense.
Mm-hmm. I do think that NIH showed during COVID with RADx and with some of the warp speed involvement that even NIH had, but particularly with RADx, the ability to do things in a different way. But I think look at how that worked and how DARPA works, and figuring out how they all work together would be a good thing. So Senator Murray and I, working together on this committee for 7 years, have increased the NIH funding by more than 50% after a decade with no real increase. It's been an important goal that we've worked on together. The concern at NIH about ARPA, or the NIH advocates, not necessarily the people working there, but the support groups and advocates of ARPA-H has always been that it would take money that otherwise would go to NIH. It appears that that's exactly what's happening here. We did $1 billion for startup money for ARPA-H last year. This budget proposes another $4 billion for ARPA-H and zero for NIH. I'm confident that based on our past working on this topic, zero will not be the number we come up with. But why did you submit zero as opposed to an increase in NIH and money for ARPA-H as well?
Appreciate the question, and to explain. When the President asked us to submit our budgets to Congress, we had to work with the baseline that we knew that was in front of us. At that point, Congress had not completed the work on a fiscal 2022 budget. And so we had to operate expecting that our baseline would be the continuing resolution, which is far lower than what you ultimately passed in the omnibus bill for 2022. Certainly now, knowing what the omnibus bottom line is for NIH, we will work using that bottom line to talk about increases for NIH. So we look forward to working with you to make sure that NIH continues to receive the robust funding that it has always received from Congress.
Yeah, thank you, Senator Murray. I'll have some other questions, but I assume we'll have a chance to ask a second round of questions.
Yeah, yes, we will do that. Thank you. Senator Manchin.
Secretary, thank you for being here. Appreciate it. Thank you for your service. On supply chains, we've spoken quite a bit about supply chains, and we learned that during the COVID-19 pandemic how fragile it is, and trying to make sure that we're able to meet the needs of the people. This administration, Biden administration, they institute a whole of government effort to assess what can be done to strengthen competitiveness and supply chain resilience, including that 100-day reviews. And later this year, I think you all will issue your first annual report to provide an update to the challenges, developments, and opportunities. So only thing, I know that we're running into these time frames and everything, so I guess what progress has the department made in confronting the supply chain crisis that jeopardize the supply of medications that patients are going to rely on and need?
Senator, look forward to working with you on that. As you know, this administration has used the Defense Production Act on several occasions to try to increase and expand our supply chain. A quick example. Last year, all the manufacturers of COVID test kits were not domestic. And we worked really hard not only to expand the number of testing kits that would be available for Americans to test themselves against COVID, but we worked really hard to make sure those were domestically manufactured. And today we have several in America that are domestically manufactured, which, by the way, they will begin to shut down those lines of production if we don't have the monies to guarantee that we will be able to fund test kits moving into the future.
You're being able to track manufacturing back. People are willing to come back into our manufacturing base.
Absolutely. You show them the support, they'll be there.
Okay. The other thing is on LIHEAP, the LIHEAP Low Income and Energy Assistance Program. We're having a hard time and advocates both from back home, West Virginia, and nationally, challenging that states face in administering this program. They're having trouble getting the people to administer the program and getting the money to be administered. So I guess quickly, have you all looked into this, and can you look into it on LIHEAP, how you can maybe help or make sure that money is getting there, or they have the administration that they're going to need, the support that they're going to need to get this money out, because it's just been very, very, very difficult for a lot of poor people.
Yeah. Americans need heat in the winter, and they need to be
Yep.
cool in the summer, and we will do everything. We've expanded LIHEAP. We will do everything we can. Senator, working with you and others to make sure that the resources that you all provided get to people who need it.
I think basically just helping them with their application approval process, that would help tremendously if you can look into that. The other thing is that I had one thing that I wanted to mention to you. I think we've talked about before. I've been trying to pass a Lifeboat Act, and the only thing it does, Lifeboat truly is saying that we're going to charge manufacturing of opiates 1 penny per milligram. That 1 penny per milligram goes to treatment centers all over America. Every one of us in every of our states have an addiction problem, but we have so few facilities, and the government can only do so much. But I think the manufacturing, that's a manufacturing fee. It won't be passed on as far as cost to the consumer. But if you're going to put this product on the market, you ought to know the damage it does. And right now we see lawsuits all over the country. I would hope you all would look in that and see if it's something you all could support. It's not onerous at all. It basically directs every penny to treatment centers. And the final thing I wanted to ask you about, the $10 billion that we're stuck on, I cannot believe it. What's it going to do? What risk are we really going to be faced if we don't get this funding?
Well, the $10 billion is certainly not enough to carry us to the end of the fiscal year, but what it does do, it lets us stay at the front of the line to make sure we're purchasing the medicines, the treatments, and the vaccines that we need moving forward. Without that, again, we could lose our place in line.
This is like the different variants. That first of all, we thought COVID-19 was over. Then we've been told, Dr. Fauci told us that there are going to be different variations, and it's exactly true what he said.
Yeah.
And now we even have more. But what's the time element? Where are you going to be crunch time? If politics is being played, Democrats and Republicans got to come together for the health of all Americans.
Our scientists are telling us that in the fall, winter, we probably will see another surge. How big, who knows? But in order to be ready for that fall or winter, we got to start purchasing today, not in the fall or winter.
I know you all have a yeoman's task in front of you, and I appreciate the job you're doing, and I just want to make sure that we can help you and assist any way possible. So communications between the offices have been great, and I appreciate that. We need a lot more, and we're going to try to do all we can to make sure we can protect America.
Thanks, Senator.
Thank you. Thank you.
Thank you. Senator Hyde-Smith.
Thank you, Chairwoman Murray and Ranking Member Blunt, for holding this hearing today. And I also want to thank the Secretary for being here and your willingness to serve and your willingness to answer these questions. On March the 11th of 2021, President Biden signed the American Rescue Plan Act of 2021 into law. Out of the nearly $2 trillion in this bill, only 6% went to vaccines and public health, despite the fact that a lot of ARPA funding has yet to be dispersed. The Biden administration continues to press Congress for more money. Over the past few months, your department in particular has asked Congress for more funding to ensure a continuation of critical aspects of the U.S. healthcare response to COVID-19. Knowing that there would be a continued need for pandemic-related health care, why did HHS divert health care-related funds toward the care of illegal immigrants who are coming here due to the Biden administration's open borders policy?
Senator, thank you for the question. And as you recall, in the midst of the American Rescue Plan, America was sinking, and the rescue plan was to do more than just the healthcare side. It was to make sure that those families who had lost their jobs, those business owners who were losing their businesses, could survive the pandemic. And so that's why so many of the resources went to keep America afloat. And today we see that very few Americans are unemployed. The economy is moving. But I get to your point on the resources. We used resources to deal with COVID in its many different facets, including at the border. And so when it came to those migrant children, we wanted to make sure that everyone was safe, including those children. So we used some of the COVID money to make sure, for COVID-related reasons, we kept America safe, and including those children, safe from any particular spread. And so we documented the spending on those programs to Congress, and we continue to show that the success of keeping COVID from spreading, including on the border, was not only important, but kept our economy moving.
Yeah, well aware of, the need for that funding and all the American children that needed the vaccines as well. Knowing these healthcare needs exist, why isn't your department working with the Office of Management and Budget to shift undispersed funds toward the healthcare priorities before asking for more money?
Senator, we're more than willing to go through with you and your team the way we have used the money. We have allocated all the dollars we have, the discretion to move towards the task of dealing with unaccompanied children or dealing specifically with COVID. But we're more than willing to get into some of the specifics if you'd like to see how we've been able to use the resources you've provided.
And staying on the topic of COVID-19, this is incredibly important to me. I've been in touch with your department for months on behalf of a gentleman by the name of Cody Flint in Mississippi. He's an agriculture pilot in Mississippi, and Cody received his first dose of the Pfizer vaccine on February the 1st, 2021. And immediately began experiencing very adverse side effects such as headaches, vision and hearing issues, dizziness, loss of balance, and a lot of pain. Due to these serious health issues, he has not been able to fly as an ag pilot since receiving the COVID vaccine shot, rendering Cody unable to provide for his family as an ag pilot in Mississippi. For more than a year, Mr. Flynn has been painstakingly going through the Countermeasures Injury Compensation Program, seeking compensation he may be entitled to based on his experience. And I've worked with him to try to navigate this process, and I've been stunned not only by your agency's lack of urgency in refusing such claims, many claims, but also the lack of the transparency in that process. And I certainly still advocate for the vaccine, and I myself received the vaccine, and I encourage others to speak to their doctors about receiving it. However, as with any new medical product, some people they will have side effects. The CICP exists for that very reason. And I'm very concerned about the amount of time it takes your agency to process claims and the lack of clarity given to those folks who were adversely affected. Can you tell me what you're going to do to address the thousands of claims currently in backlog at HHS, and what are you doing to improve the transparency of the CICP process so that Americans like Mr. Flint are properly compensated in a reasonable time period?
Senator, well, you've asked a very important question, not just to Mr. Flint, but to so many Americans who did what they should, which is to get vaccinated. We're finding that there are a number of Americans who are suffering from what we're calling today long COVID, and we are doing everything we can to make sure we provide them with the support that they need to get through this. Who knows how long it may be. We're doing research on this as well. I will say this, transparency is important, accountability is important, and we want to make sure that those who really do have a medical issue to report are the ones who are receiving the assistance. We, as you're aware, in some cases, some of the COVID money has been used fraudulently by many. We want to make sure that no one's trying to game the system to get relief for something that doesn't exist. That way we can reserve the funds that we have for people like Mr. Flint and provide him with some help. And so why don't we do this? I'm more than willing to have my team reach out to you, and we can see about Mr. Flint and where he is in his process, because we have heard this story on many occasions. We know that millions have been saved because of the vaccine, but we also know that many people are still suffering, so we look forward to working with you.
Yeah, he's totally lost his income, and the financial burden is just unbelievable. But the frustration of trying to just get some answers of when something could be done for him for this compensation has been very great. Thank you for your help, and thank you for answering my questions.
Thank you. Senator Reid.
Thank you very much, Madam Chairman. Let me go back, Mr. Secretary, to an issue that Senator Manchin raised, that's LIHEAP. I'm pleased to say that the president slightly increased LIHEAP in his budget this year, but the reality is that energy prices are just exploding. In the past 12 months alone, the price of natural gas has increased by 22%, and the price of heating oil has increased by 70%. Would you support any type of supplemental funding to enhance the LIHEAP so it can deal with this extraordinary increase in prices?
Senator, we would support any effort to try to further fund LIHEAP given the circumstances that we're in.
Thank you very much. Also, let me go back to the point you raised, which I'm pleased that you're moving aggressively. That's the 988 number. We all understand that we're in a mental health crisis in the country. I hear that not only from my constituents, but as I visit troops around the globe, I hear it from our military personnel also. And we just had a terrible incident of multiple suicides on one of our Navy carriers. 988 is a great idea, I think. I had something to do with it. That's why I think that way. But anyway, it's going to allow someone to call who has a suicidal ideation and try to get help. But it has to be implemented thoroughly throughout the nation. In Rhode Island, my state has done, I think, a very good job of setting up the counseling centers, the technology, et cetera. But as I understand the system, if someone calls in and a state doesn't have the infrastructure, they're referred someplace else. So you have not a very good relationship, long distance, and also adding more work to states that have enough work already. So can you give us sort of a sense of how the nation is doing, and we're all going to come online together?
Thank you, Senator. And I do believe your state is doing very well in moving forward. We have a patchwork right now of call centers that accept these calls from folks who are suffering from mental stress. We're trying to turn that into one cohesive network. It's difficult because it won't be run by the federal government. It'll be run by the 50 states, the territories, and the tribal governments. But what we're doing is working with them with your support. We have so far invested $300 million throughout the country with all the states, local governments, to try to make it work. We will also provide backup call centers to make sure that if any particular location is receiving a large volume of calls, there will still be someone who answers the phone, because the worst thing you can have when someone reaches out instead of goes in the wrong direction is to get a busy signal or be put on hold.
No, I completely agree, Mr. Secretary. And, there are long-term costs to not implementing something properly. We understand that. And this is an opportunity we have to get it right. I also understand the President has requested nearly $700 million in his budget for the National Suicide Prevention Lifeline. And I think you'll need that money, but I think right now we have a few months to get it right. And if you need additional help or assistance, please let us know.
Thank you. We are keeping tabs. We're contacting every governor of every state every month to let them know where they stand.
Well, thank you, Mr. Secretary. It was a pleasure working with you in the House, and it's a pleasure working with you.
Thanks, Senator.
In your capacity. Thank you.
Senator Moran.
Chairwoman, thank you very much, Mr. Secretary. Good morning. Let me start with a topic that I asked you about in your confirmation hearing, or in our conversation prior to your confirmation hearing, organ transplants. For over 30 years, HHS has contracted with United Network for Organ Sharing, UNOS. It is currently under congressional investigation by the Senate Finance Committee. I would tell you my experience is their attitude, approach, their policy has been very discouraging and detrimental to the lives and well-being of those individuals who are hoping to be a recipient of an organ transplant. Damaging geographically in their outlook and damaging geographically in their policy. The contract that UNOS holds with HHS for organ procurement and transplantation is up for competition in 2023. A recently published request for information on the contract, which I joined Senator Grassley and Senator Wyden and Young in supporting, this RFI is an essential step to improving the nation's organ transplant network. Numerous reports have highlighted the best way to increase competition for the contract is to divide it up. I don't know whether that's the right answer or not, but I'd love to hear from you what specific steps. I want to know that you are aware of these problems and what specific steps you intend to take to increase competition for potential organ procurement and transplant network contractors.
Senator, this is an issue where you have real people who come to you and tell you about their real life circumstances. So we actually absolutely know about this. We are trying to prepare to make sure that in the process of coming up with these new contracts, we increase supply, not diminish supply, that we make it a more fair distribution of these organs, and that we make it more transparent. And that's in the works. And what I offer to you, because I think it's so important across the country, is we will work with you if you and your team have any particular ideas. If we haven't already incorporated them, I'm more than willing to make sure we take that into consideration.
If you would give me a name of a contact, you give my staff a name of a contact today, we'd be glad to follow up. I'd love for your team to hear from not only me, but from those who are actively engaged in trying to make this system work better.
I'll follow up with you at the end of the hearing, whether we meet directly or through our staffs. I'll make sure that that happens.
Xavier, thank you very much. Let me highlight a couple of other things. The National Strategic National Stockpile, the budget requests $975 million for the national stockpile for FY23. Ensuring that, and I raised this topic in the authorizing committee, and I want to make sure that it's not lost between the two committees. I serve on both of them. But ensuring that the SNS is restocked and maintained to its maximum capacity is important. I think it became more important with Russia's invasion of Ukraine. And I would ask your commitment to prioritizing fully stockpiling the biodefense and pandemic response supplies maintained by the SNS.
You've got my commitment, and I hope you'll take a look at the President's pandemic preparedness plan moving forward. I think you'll like what you see.
Thank you very much, and I will do that. Rock Regional Medical Center is a new hospital in the suburbs of Wichita. Me and my office have been working with Health Resources and Services Administration for the past year, flagging Rock Regional, which did not receive a fair allocation of provider relief funding. It is a new hospital and was treated in a way that it seemed to me that HRSA seemed uncaring about solving this problem. And it's not the only hospital in which that's the circumstance, and I don't think I'm the only member of the Senate who believes that. So why is HRSA so unwilling to reconsider their methodology for PRF funding for new hospitals?
Senator, you are absolutely correct. You are not the first, and Rock Creek is not the only facility. Here's the difficulty. All those funds that were dispersed before 2021 were done under a formula that we could not change. That formula, to your point, relied on looking at past performance. If you're a new hospital, it's hard to talk about your past performance. That did damage a lot of these facilities that were newer. The difficulty, as you'll understand, is we could not change the statutory framework of the Provider Relief Fund and the distribution. To undo that would have meant to have to pull back all the funds. What we did do was we changed the formula with the tranches of dollars that still existed that we could move forward with. But we're more than willing to work with you and those providers in your state so we can try to address some of that. But it's tough because we can't undo what was previously used.
You described it. I'm always pleased when an administration official of any administration says they want to follow the congressional law. That's pleasing to me. It's not always the case that I find it to be the case that it happens, but I would indicate that we thought this could be better addressed in the later phases, and our conclusion was that it was not. So I'd be glad if you, again, help me get, again, to somebody who can address this issue.
Yeah, and if you'll permit me a quick response, it's not that we didn't want to, it's just that what was left with the final phases was so little, and there were still so many new incoming requests, and some facilities that had gotten no money whatsoever. For example, nursing homes had been left out in the first tranches. So it's not that we didn't want to go back, it's that what was left, we couldn't try to undo the formula requirements of the previous administration.
Thank you for your explanation.
I will now recognize myself for 5 minutes of questions. Secretary Becerra, thank you so much for appearing here today. I am as are you, prepared to talk about the fiscal year 23 budget. But I did want to acknowledge what we saw from the Supreme Court on Monday night. If the court is really going to legislate from the bench and turn back the clock 50 years on Roe versus Wade, then I think the Senate needs to pass the Women's Health Protection Act, an act that I have co-led with Senator Blumenthal. And frankly, I would say that if we need to eliminate the filibuster to get it done, that is what we should do. And I encourage strongly my colleagues to support that effort. Now, the Biden administration has worked to expand access to comprehensive, affordable coverage through the Affordable Care Act. And I support these efforts. But unfortunately, we continue to wait for the administration to address the issue of junk insurance plans. I wanted to share the story of Philip from Janesville, Wisconsin. He received a $34,000 bill for an emergency room visit and an overnight stay at an area hospital. Rather than paying the bill, his junk insurance plan rescinded coverage due to an alleged pre-existing condition. When Philip wrote to my office, he said he wanted to warn people about the dangers of these plans, and he shouldn't have to do that. So, Secretary Becerra, during the hearing to consider last year's budget request, I asked why the administration hadn't yet taken action to address these junk insurance plans. It's been a year. Can you tell me when the administration will take action to address these plans?
Senator, absolutely appropriate question. And we are in the midst of rulemaking. As you know, rulemaking can take a little while, but we started that process because of what you've explained. It does happen. Junk plans are leaving Americans with these tremendously expensive bills. Fortunately, with your help, the No Surprises Act is now law. And so individuals who get these surprise bills will no longer have to worry about paying such exorbitant bills. We hope that what we find is between the No Surprises Act statute and our change to try to undo these junk insurance plans, that we will provide Americans the protections they thought they had.
Yes, well, please keep me apprised of the timeline. We're very anxious to see this addressed in rulemaking. I know that you were just asked some questions about the 988 suicide prevention and lifeline hotline. I want to just add that I was very proud to be the co-lead on the 988 bill, and very supportive of the additional funding in the budget to prepare the states to make this line live. I still, though, hear from leaders in Wisconsin who are concerned that our state may not be fully prepared for the 988 transition. So can you tell me a little bit more about the guidance that the department is giving to states when it comes to securing the additional funding, and do we need to take more action to make sure that there's adequate preparation in the states for this transition?
Senator, the most important thing you can do is to continue to advocate that your state build the capacity to handle its 988 response. There are several states that have. We're working with every state with the resources you have made available to us to work with states, the territories, and the tribal governments. But without the states taking control of this, it will be very difficult to believe that they'll be able to manage the calls that they'll get. And the last thing any of us want is for someone who's reaching out in a time of pain to not have a real person respond.
Can you, as a follow-up, make me aware of the interactions that you've had with Wisconsin? It is troubling to hear these concerns raised by mental health leaders, and want to make sure that our state is accessing the federal funding that is available.
Senator, I can make sure we give you a copy of the letter we send to every governor, in this case your governor, to let them know where they stand in implementation.
I see I've run over my time. We might start a second round of questioning now, and I will call on Senator Blunt for a second round.
Thank you, Senator. Let's talk about mental health for just a little bit. I was pleased in the budget you've shown asked for a substantial increase in the certified community behavioral health centers, allowing them to continue to treat mental health like all other health, and also making the current demonstration program permanent and allowing all the states and territories to participate. So I'm pleased to see that. I look forward to seeing how far we could go to create a reality of that request. One thing I did want to talk to you about with the mental health agency, SAMHSA, the budget was released on March 29th. 3 weeks later, we got the first of two notices of a fairly substantial reorganization, three reorganizations. One established a new Office of Recovery within the Office of the Assistant Secretary. Another created an Office of 988, which is the suicide helpline number, Behavioral Health Crisis Coordination. A third established a new program of prevention initiative. We have several concerns here. One is there's nothing in the budget that reflects these agencies being there, or so far no direction as to where money should come from to fund them. Two, I think some of the prevention efforts have become more harm reduction efforts than I think the Congress would have intended for, or certainly that I would intend for. And three, there are even press reports that the administration's thinking about safe injection sites under the guise of prevention, even though I believe those sites are against the law. Now, we did have an update just yesterday, the first update of our staff of what that Office of Prevention might do. And we asked about some of these controversial things. I think we're not at all sure yet that there's enough information out there to not be concerned about this or not stay fully engaged. One, why would we get that kind of reorganization 3 weeks and only 3 weeks after the budget was submitted? And two, how do you expect us to incorporate this into the budget that you've already asked for?
Senator, thanks for the chance to respond. And as I mentioned to you previously in a conversation, we would reach out to your team. We have reached out to your team. Let me tell you what my team is explaining to me. First, the reorganization does not impact the budget. We're going to work with the monies that we have. We don't need new authorities, because what we're simply doing is reflecting the president's priority on behavioral health to really tackle this, and also to focus on trying to have a new strategy on drug use. And so what these offices are doing is essentially consolidating what exists in our agencies to really focus in more directly on these very important subjects. And so what we can do is we'll follow up again with your team to give you details. As I said, it doesn't impact the budget, and what we can do is explain how the reorganization helps us achieve the president's desire to really tackle mental health and drug use as directly as we can. We established, for example, a coordinating council among all of HHS's agencies so that we wouldn't wait to learn what each other is doing. SAMHSA and the Office of Public Health are coordinating that, so we're working immediately to deal with mental health. And so we're going to do more of that so we can make the best use of our money, but we'll follow up.
Well, we need you to do that, and it will impact the budget to the extent that we need to know where that funding comes from and what new lines need to be created for that reorganization if there need to be new items, and we look forward to continuing to work with you on that.
Thank you.
Thank you, Chair.
Thank you, Senator Baldwin.
Thank you. So I'm thinking back to the first months of our struggles with the COVID-19 pandemic and all of the work we were doing with first responders and hospitals and others to secure PPE, in particular respirator N95 masks that were in desperately short supply. And at that time, American companies began stepping up, and they retooled manufacturing lines to help compensate for these weaknesses in the supply chain when there was a global demand. And working around the clock, they met the need for essential products, including N95 respirator masks and other PPE. These companies helped save lives, and now they're in trouble. I wrote to President Biden earlier this year urging him to prioritize long-term contracts for the purchase of masks made by American workers in American factories with American materials. So I wonder, Secretary Becerra, as Health and Human Services works to replenish the strategic national stockpile, can you commit to prioritizing American-made PPE?
Senator, absolutely. That's what we have done. As I mentioned earlier, we made it possible to actually have tests that were manufactured here. But to keep those lines of production going domestically, we have to be able to commit now. Otherwise, they're going to start to phase those lines down, and it would take months for them to try to ratchet back up, which could cause us to have to go to foreign sources for that supply of tests or masks.
Are you procuring American-made N95 masks right now for the national stockpile? Have you been?
Yeah, and I'll get back to you on exactly how much of that might be domestic production, but you recall that we put out about 270 million N95 masks to Americans free of charge to help people deal with COVID, the pandemic. We are resupplying the stockpile, and we're doing everything we can to make sure that when we do resupply, it is with domestic manufactured product.
Okay, thank you.
Senator Braun.
Thank you, Madam Chair. So when we've had opportunity to talk, early on I've been a proponent of reforming healthcare by making it more transparent, more competitive. I think that's largely been lost in all the other issues that have come up. Still interested in that, but a subject that is really creating controversy across the country would be gender-affirming care for young people, and it's on the HHS website. I'd like to work through what gender-affirming care actually means and do it with a couple subjects in mind: drugs and surgeries. Start with prescription drugs. I don't think these drugs have been proven safe and effective for the use you're recommending. It's probably why the FDA has not approved puberty blocking and hormone therapy drugs for gender transition. Anytime a physician, prescribes it, they're doing it off-label. Would you agree that off-label prescriptions for usages not approved by the FDA are potentially dangerous for patients, especially kids?
Senator, thank you for the question, and that is a question that HHS, including FDA, CDC, have been tackling quite a bit as a result of the pandemic. What I would simply say to you is that the FDA would raise alarms if they saw that a particular medicine or treatment were being misused. And at this stage, what we know is that for a drug to be out there available, it has to be safe and effective, as FDA has found. And so what I would simply say with regard to this particular subject is When individuals go in for care, it is their physician who is making that decision with them about what type of medicine or treatment they should receive.
You know, if you'd use that same logic on what we've just navigated through COVID, it seems like there would have been a different point of view. And to me, for many parents across the country, this has more potentially tragic consequences, and it seems like it's a double standard. Let's look at surgeries that would be even more impactful. And I'm not going to mention the particulars there. It's almost grotesque to mention what could occur. Could you explain what irreversible top and bottom sex change surgeries are and why that is on the portal as well?
Senator, as you've just indicated, there are many different types of procedures that can be deployed. What I will say to you is, again, in any case, no individual, no patient will proceed forward unless his or her doctor has advised of the procedure, and it is considered by the FDA and others who have to go ahead and certify a medicine or a procedure to be safe and effective.
So I'll try to distill it into a more simple form. In what case would it be appropriate to perform irreversible sex change surgery on kids?
Those decisions are made by that individual in consultation with physician and caregivers, and no decision would be made without having consulted appropriately.
You know, I think the government shouldn't be pushing or have it out there on a portal that moves you towards irreversible sex change therapy. And I think we just need to think about it carefully, because we're navigating into territory that we've never done before as a government. Kids going through this are having a hard time. We should be maybe focusing more on mental health and not things that are irreversible. And I think leading the HHS, it might be a little more important to be a little more definitive rather than making it look like, well, a laissez-faire approach, and whatever happens, happens. I think that's out of sync with most of America, and it seems to me it'd be wise to maybe back up a little bit.
Senator, I hear what you're saying. I believe that we should help those have the life-affirming care that they need. There are many transgender youth who have actually gone in the opposite direction, taking their life. If we can make a life better for someone in America, we should, especially if in consultation with their physician, they approve of those procedures.
Do you think it'd be reasonable, my last question, in the meantime, to maybe take this off the site until there's a little more kind of science built into the approach, a little more discussion about what may or may not make sense, rather than having it out there where it looks like it condones the process?
I would say to you that many of our medical experts would tell you that we've explored this subject for a long time, and what we find is that we are helping improve the lives of many Americans by providing them with the care that they have chosen with the informed consent of family and also with the consent and advice of their own physician.
Thank you.
Thank you, Senator Shaheen.
Thank you, Madam Chairman. And thank you, Mr. Secretary, for being here this morning and for the work that you and everyone at the Department of Health and Human Services does to promote the health care of the people of this country. I was stunned, as I'm sure all of us were, by the news on Monday when we saw the draft opinion leaked from the Supreme Court that proposed eliminating access to safe and legal abortions for women and for health care that goes along with that. I think it's stunning, and this is a statistic that I found incomprehensible, that the United States could become one of only 25 countries in the world that would totally ban abortion. And if this decision is correct, and this is what the court decides, it would leave up to the states decisions about women's reproductive freedom. That presents challenges in states like mine, New Hampshire, where we have seen Funding denied to family planning centers on the front lines of these efforts, even though it's funding that does not support performing abortions, but these family planning centers provide health care to thousands of women in New Hampshire. We appreciated your visit up to see how Title X is working to keep doors open for family planning services for thousands of women in the Granite State. So I'm very concerned about what's going to happen, and I wonder if you could update us on the work of Health and Human Services Reproductive Health Care Access Task Force.
Senator, thank you very much. We are going to double down on the effort to make sure that the legal rights of all Americans, women to access the care that they're entitled to, continues forward. I yesterday had an opportunity to address a number of the representatives of many of the insurance plans, health insurance plans in America, and made it very clear that we intend to continue to enforce the law. We have heard complaints that some women are not being provided with access to the care that they're entitled to through their insurance plans. We will continue to do that. We will continue to support the efforts, family planning efforts that are available through Title X. We will also make it clear what the law requires of anyone who accepts federal funding through Medicare or Medicaid to provide services to all Americans without discrimination. As I said, we're going to double down and make sure that no one goes without the care that they're entitled to.
Thank you very much. I appreciate that. Another crisis that New Hampshire and so many other states in the country are dealing with is the substance use disorder epidemic, and we've seen how the COVID pandemic has exacerbated that. In New Hampshire, we're still in the middle of this crisis, and the state opioid response grants have really been a vital source of funding for our state to provide treatment that people need. So as you work to administer those grants this year, will you commit to working with me and with other members of New Hampshire's delegation to ensure that changes in a state's ranking in opioid overdose deaths don't result in large-scale reductions in funding? One of the things that, and I should preface that with saying, one of the things that we've seen in New Hampshire is that our overdose deaths have leveled out to some extent because we've gotten so good at using Narcan and providing Narcan to local police departments and firefighters so that they can respond when someone has overdosed. But that doesn't mean the underlying problem isn't there.
Senator, first, thank you for keeping this issue of the SOAR grants top of mind to make sure that no state, no community suffers a cliff in the funding that they need to continue to provide service to those who are suffering from drug use. We will continue to work with you. We have provided additional resources. The budget proposes $475 million above the previous fiscal year because we understand how important it is. But I have no doubt that you will continue to insist that we do this the right way and that no one loses the funding they need.
Well, thank you. I know that's of interest to others on this subcommittee, so thank you very much. A final question has to do with the Affordable Care Act premium relief, which one of the very positive aspects of the American Rescue Plan was the Act's premium tax credits that extended for 2 years to help provide coverage for people who can't afford the cost of health care. Those provisions are set to expire at the end of this year. Can you talk about what the plans are to ensure that we don't see a number of people kicked off of the Affordable Care Act insurance because those premium tax credits are expiring?
Senator, thank you for what you and your colleagues did to make that possible. As a result, today more Americans have access to health care. They have insurance, health insurance, than ever at any point in our country's history, a greater number. And part of that is the 14.5 million Americans who receive their coverage through the Affordable Care Act marketplace. That came because you made it possible for us to avoid the cliff that some families faced when it came to the cost of coverage. By providing those subsidies, it made it very affordable, and in some cases for some families so affordable that they were finding that they were paying $10 or less per month for their monthly premiums. And as I always try to say, go try to see a movie in America for less than $10 a month, for one movie, not for a whole month. And so we will continue to work with you because it has clearly proven itself successful to make sure Americans can afford to have their health insurance coverage.
Can I just ask one follow-up,
Yes.
Madam Chair? So when you say you'll continue to work with us, should we expect a proposal coming from the administration to extend those premium tax credits or to look at other ways to provide help to people who need help with the cost of health insurance?
The President's made it very clear we want to see those premium tax credits extended. In the President's proposals, Build Back Better proposals, and others, we have talked about how we can continue to expand access to health care and reduce costs, and we will continue to work with you.
Thank you. Thank you, Madam Chair.
Senator Moran.
Thank you, Chairman. Mr. Secretary, in the time that I've been here, you've been asked a number of times about 988. Let me just ask a specific question about your plans. Would you fill in the details on the $700 million request for the National Suicide Prevention Hotline with the opportunity to explain the reasoning behind that amount and what it would be used for?
Senator, thank you. We're finding that because we've had this patchwork, as I've mentioned before, of response, and we're trying to make it into one unified response. So if you today are in D.C. and you're feeling stress, but then you travel into Maryland or West Virginia, you don't find that you lose the same access to services that you might have had if you were in one of those different locations. To make that happen so it's seamless requires a great deal of support because the states are accustomed to dealing only with the folks in their communities. We're trying to make it so that it makes no difference. If you have a area code phone from the state of Kansas, but you happen to find yourself in my state of California, you're still going to get response regardless of where you are. That requires resources. Some states have moved to actually provide a permanent line of funding for their 988 services. Others have not. We don't want to see anyone fall through the crack, and so we're working hard to provide them with services. We put in over $300 million in this current fiscal year. The President's requesting more because we know it's not just a matter of making sure the system works, but moving forward, we want to make sure that the follow-up services are available so that you don't just get a voice that says, we're here to help, but that the services will be there to follow within the states.
So is the $700 million utilized for the technology, the technology of the phone call, or in providing actual services once you get somebody on the line?
More for the services. So, for example, many states are not able to handle the call volume they get. We want to make sure that regardless of where you are, even if a state is receiving a high volume or exceeds its capacity, that call will still get answered. So we have backup call centers that are set up. That is something that we're really supporting because states, if they don't have enough in their own state, are probably not prepared to fund a callback or call them capacity. So we're trying to make sure we have those fallback centers in place.
Excuse my obtuseness, but that sounds to me as if that's the technology of the phone call, the access to reaching somebody, that's not money to provide the psychologist to talk to or the mental health counselor on the other end of the line?
The technology isn't that difficult. We're actually working with the FCC right now to try to make sure that we can make sure that those calls can be connected regardless of where the individual is and who the responder will be. So we're going through those technical aspects, but the resources are to make sure there's actually a professional, a health professional, who will be available to answer those calls. Some states, as I said, are more prepared than others. That shouldn't be a reason why an individual who's crying out for help doesn't get support.
Secretary, so if a state is lax in their implementation of this legislation, there will be a federal response to the phone call from that state?
Well, that's the thing. We don't. You all did not give us the resources or the authority to essentially run the whole lifeline. But what you did give us was the capacity to help states lift up their capacity. And so we're working very hard right now for the immediate future to make sure that July 16th, if someone calls 988, they get a response. Some states will be better prepared July 16th than others. The funding that we're requesting lets us get everybody up to speed.
I think the way I'd say what you're saying is they get a response, and the response is more than someone saying hello.
Yes.
It's the follow-on to that.
So crucial,
Yeah.
so crucial.
Okay, thank you. I was one of the original sponsors of this bill. I'm trying to figure out how, I guess what you're describing is that the legislation provides what you're supposed to do, and you're trying to do it.
Yeah, and we can provide you with an update on where Kansas is because we're providing every governor with an update every month of where they stand so they are aware of what they need to do or how well they've done.
Okay. Thank you, Madam Chairman.
Thank you. Secretary Becerra, I want to go back to a topic that Senator Sheen mentioned, and that is that our communities are really being hammered by the opioid crisis. Just last year, more than 105,000 Americans died from a drug overdose. In Washington state, synthetic opioid use is up drastically. Overdose deaths are now up 66% since 2019, and over half of those are attributable to fentanyl. This is just unacceptable. We really need some urgent action from the administration. Can you talk to us about what your plan is to stop the harm being caused by opioids, especially fentanyl?
Well, Madam Chair, in response to some of Senator Blunt's questions, I mentioned that we have reorganized within HHS to make it a priority to address drug use and address the disorder that is there, especially with opioid. So we have come up with a different strategy. We forget about the stigma, we forget about the old way of doing it, and our strategy now not only relies on prevention and treatment, but on harm reduction and follow-up services so that we don't let people regress. And so what we're doing right now is working with local communities, because we don't do it at the federal level. We work with local communities with the resources you all are giving us to help beef up their capacity to provide not just testing and treatment, but also to help them with harm reduction.
Well, I am especially alarmed by the rise in overdose deaths among adolescents. Fatal overdoses among youth nearly doubled in 2020 and have continued to rise since then, which appears to be driven by these counterfeit pills that are laced with fentanyl. Parents in my state want to know, what is the Biden administration doing to protect our kids and prevent young people from seeking out illicit drugs and make life-saving overdose reversal drugs more available?
Well, Senator, we broke through that ceiling that existed that prevented us from supporting local successful operations that, for example, let someone know if the drug they were about to take was laced with fentanyl. The bugaboo back then, the stigma was, oh, you're helping someone take drugs. We'd rather save a life than judge that person who's about to take a drug, because they will take the drug whether we try to help them or not. And so today the federal government will support those local programs that are, for example, providing fentanyl strips to people so they can test that drug that they may be about to use to find out if it's going to have a harmful.
Does that help adolescents?
That would help anyone who comes in and who has access to that service from that local provider.
And kids would seek that out?
Oh, Madam Chair, there's everyone, every walk of life, every age as well, who's coming to some of these centers. Now, some of these kids may require some adult authorization in order to take certain treatments, but fentanyl strips are available for those who are about to inject themselves or use a drug that is, again, could likely kill them.
And kids know about this?
I suspect many adolescents are aware of some of the local anti-drug programs that are available. I can't tell you I know if they make use of them directly or not, and I can't tell you what every state has in terms of laws and making some of these services available to those who are adolescents, but I do know that those programs are made available to those who have drug issues.
Okay. Well, let me just change the topic a little bit. The pandemic, as you know, has been really hard on our kids and has turned their lives upside down. So they've lost time at school, time with their friends. Some have lost loved ones, and they're dealing with a lot of stress and anxiety and trauma, and they really need our help. But even before the pandemic, I was hearing from parents who are frustrated by how hard it is to find mental health services for their kids. The president's budget would invest heavily in crisis care systems, which I agree are important to handle emergency situations and prevent tragic outcomes. But let me be clear, children should not have to wait until their mental health hits this crisis point to be able to get care. Parents are really desperate to get help for their children here. How would this budget, particularly your proposal allowing states to use 10% of their mental health block grant funding for prevention and early intervention programs, help with that?
Madam Chair, let me point out one particular program that I know you and Senator Blunt have worked hard on over the course of some time, and that is the Certified Community Behavioral Health Clinics and how we are planning to expand access to those. We provide about $250 million for the expansion of those services because we know that locally in the community, if a family, if a young person has access to those services, we get to them a lot sooner and perhaps save a life. And so we're going to try to expand that. The $51.7 billion 10-year investment that the President's making in mental health services is transformative. If you all pass that in the President's budget, we will be able to do far more in reaching these families because too many, as you said, don't have the access they need.
Thank you very much. That will end our hearing today, and I want to thank my fellow committee members and Secretary Becerra for a very thoughtful discussion about how we can do more to support our communities and keep people safe and healthy and address the challenges we hear about from back home. For any senators who wish to ask additional questions, questions for the record will be due May 13th at 5 p.m. The hearing record will also remain open until then for members who wish to submit additional materials for the record. The committee will next meet in Dirksen 138 Wednesday, May 17th at 10 a.m. for a hearing on the Biden administration's budget request for the National Institutes of Health. Committee is adjourned.